Hey everybody, I'm Dr. Brady Wyrick. I'm the Director of Regenerative and Integrative Medicine here at Sensor Medica Clinics. I'm a chiropractor by heart and by training, but I want to share with you the protocols that we use here in our clinic for our freeWave extracorporeal shockwave therapy. Hey everybody, I'm Dr. Brady Wyrick. I'm a chiropractor by training and by heart, but I'm also the Director of Regenerative and Integrative Medicine here at Sensor Medica Clinics. What I want to share with you today is the clinical protocols that we use for shockwave therapy. Keep in mind these are clinical protocols that we've developed, and there's no cookie cutter approach to patient care, so keep in mind that you do need to, as the clinician, make clinical decisions per patient and modify these per patient as per the patient's needs. But this is what we use most commonly to get folks started. So first off, let's talk about peripheral neuropathy. What we do for these folks is, for the first 3 application, is we will do 1,500 pulses per foot at 70 millijoules and 18 hertz. We do this to test to see how they're going to respond to it. Because if we come in and go full speed or full power or whatever you want to say, however you want to say that, then we could actually cause them to have a little bit of pain. So we do this for the first 3 treatments, where we'll go 1,500 per foot, then 70 millijoules and 18 hertz. Then after that, if it's tolerated well, we will increase the energy output, we'll increase the frequency to 90 millijoules and 22 hertz. Now, I have in here 15 to 18 visits. But when you combine the Giga Laser, and you can see here that we put it setting 4 on the Giga Laser, when you combine Giga Laser with any of these protocols, then you can generally cut these treatments down to about half. Also keep in mind that this is per foot, and if their neuropathy symptoms come up above their knees or beyond, then you need to add that right there to the posterior knee, where the tibial and the common peroneal nerve combined. Now, with these cases, we do say that custom dynamic orthotics are a must, and here's why. These folks with neuropathy, they lack sensory feedback, and because of that, they are at a higher fall risk. So using these custom orthotics can actually stabilize their gait and mitigate some of that fall risk. So that is peripheral neuropathy. Next up is osteoarthritis. Generally speaking, we'll do 2,000 pulses at 70 millijoules and 15 hertz. If we're going to go into the hip, which is a much deeper joint, then we increase the energy to 90 millijoules or even beyond, depending on the size of the patient. We use 7 to 8 visits. Again, you can cut that in half by using the Giga Laser, and if you include that in the dynamic orthotic as well, it can help them heal faster. For our regenerative medicine patients, these are the protocols that we use. 1 week after, we'll do a stem cell exosome injection. Then we will use this on the joint that we injected, and we usually do that about 4 times post-injection. So there is an application for regenerative medicine as well. Plantar fasciitis, what I will tell patients when I meet with them for plantar fasciitis is that using shockwave laser will get rid of the pain, and then the custom orthotic will keep the pain from coming back. But for plantar fasciitis, we'll use 2,500 pulses per foot at 90 millijoules and 10 hertz, and we typically tell them we can wrap that up at about 6 to 7 visits. And then last but not least is Achilles Tendonitis. Achilles Tendonitis is 2,500 pulses per Achilles tendon, 70 millijoules, 10 hertz, anywhere from 10 to 15 visits or less if you use the laser. And I did forget to put in here, the laser would be at setting 2 for this particular application, and of course we want them to do a dynamic orthotic to stabilize that gait while the tendon heals. So those are the clinical protocols that we use. Hope you enjoyed this. If you have any questions, please feel free to reach out to us. Thanks. We'll see you soon.